Our special populations is youth, and that'll be from puberty until 19 years old. So when looking at the youth, it's important to understand the demographic, so why they might be physically active. So with the youth, activity is much lower than we've seen in the past, and we are seeing higher prevalence of childhood diabetes, as well as a high prevalence of obesity rates in Canada. Specifically in Canada, they've actually found that it's nearly tripled in the last 30 years, which leads to an increased risk for diabetes, high blood pressure, high cholesterol, and asthma. In terms of understanding the demographic, it's important to understand that they're not the same as adults. They have differences. If we're looking at the earlier part of this age bracket, they actually have smaller hearts at the younger age, which means less of a cardiovascular capacity. And they have higher heart rates in general as youth, so at rest and at maximum. There's also some psychological differences between them and adults. They have parents that are around. They're not entirely in control of what they do all the time. So that would mean that maybe they might have some barriers to physical activity if their parents are a little more conservative with the safety approach, meaning they may or may not get all that many activity options, as well as if they have parental models for good physical activity habits. They'll also have different developmental needs than adults and most likely different goals. If we're looking between a 40-year-old man and a 13-year-old boy, there will most likely be a difference in goal there.
So next would be the pre-participation screening essentials. So prior to starting any sort of assessment or physical activity program, the client must undergo a series of consent and pre-participation forms. Given the population, the youth must have parental or guardian consent before starting any sort of assessment or program. Documents like the Get Active questionnaire and the informed consent for the youth must be signed by parent or guardian if applicable. There are legal reasons behind this, and they must do this in all cases. This is a very important step that cannot be skipped. The pre-participation screening also serves as a tool to ensure the client is receiving a plan that is suitable for their capabilities. This will also help back up your recommendations and allows you to get to know the client a little bit more. The common conditions that are observed in this population include asthma, and now more prevalent than ever would be diabetes, also including previous injuries and other outstanding medical diagnoses.
While adults are meant to do 150 minutes of moderate to vigorous physical activity every week, youth should aim for at least 60 minutes a day. We should also include 2 to 3 days per week of resistance training, but not on consecutive days. More details on resistance training are found in the exercise prescription section. Again, it's important to go through all of our pre-participation screening forms. We have additional information that can be found in the Informed Consent Youth form in the CSEP PATH manual. Resistance training should always focus on technique and should be monitored closely to ensure safety. We should use light or body weight resistance, especially at the beginning, to make sure that we're performing lifts correctly.
So now touching on exercise prescription, as per the guidelines detailed in the CSEP manual, you should participate in low to moderate resistance training 2 to 3 times a week, not being on consecutive days. This would include starting with 1 to 2 sets of 8 to 15 reps at 60% of their 1 rep max. This can progress to 4 sets of 8 to 15 reps of 8 to 12 exercises. On top of that, they should participate in vigorous and bone strengthening activities 3 times per week, as well as several hours of light intensity activity. When creating a plan, you should also consider creating it based off the client's interests and adding variety. In turn, this can help them discover what they like, and this will lead to more participation, which can also help to change their behavior surrounding physical activity.
As a youth client becomes familiar with basic physical activity and has developed a healthy habit of exercise, more complex activity can be introduced. Sport-specific training such as footwork drills, hand-eye coordination exercises, and plyometrics are not only a great way for the athlete to improve their on-field performance, but also develop their balance, acute motor control, and visual tracking. This is important because these will be valuable skills for life outside of sports and as the client ages. Introducing sport-related resistance training is also a beneficial progression when dealing with a determined athlete. This new aspect of exercise serves to maintain their motivation for the sport and improve their overall performance. In fact, a recent study by Pardo, Maynor et al. Showed on average youth who participate in sport-related strength and power training see greater performance outcomes than those who participate in sport-specific training alone. Overall, youth between puberty and 19 years old represent a wide range of physical maturity Therefore, judgment of a qualified exercise professional is crucial in considering the client's special considerations, program plan, and logical progressions.